As you probably is aware, many of you, there's been controversy now for 2 decades as to whether we should use antiviral treatment in people with high, what is otherwise traditionally thought of as normal CD4 cell count. There's a lot of controversy around that question, in particular because treatment obviously reduces transmission. I'm sure Mike Cohen will expand on that point. So to address that controversy, we designed a large clinical randomized trial comparing immediate initiation of antiviral treatment as opposed to deferral until the CD4 cell count had dropped to traditional levels where there's clearly a benefit of treatment if you drop below those counts. The study is large, 4,685 participants from 215 sites in 35 countries on all continents of the world. So Australia, Asia, Europe, Africa, Latin America, and United States. As Julio said, we recently was informed by the DSMB that the efficacy endpoints has been met in terms of a reduced risk of what we call serious AIDS events. Typically, and most importantly, lymphomas, malignant lymphomas, and Kaposi's sarcoma. And equally, also a reduction of what we call serious non-AIDS events, which are end-organ disease, clinical end-organ disease, or non-AIDS defining cancers. For that component of the primary endpoint, we also now is able to demonstrate benefit in favor of immediate treatment. The benefit of the serious non-AIDS events were predominantly driven by a reduction in risk of cancers, whereas the data is not at least demonstrating any benefit in terms of reduced risk of cardiovascular disease. So this trial demonstrates conclusively that in people who lives with normal CD4 cell counts, that there is a hole in the immune system if you're HIV positive, and that antiviral treatment is able to fill those holes at least partially. There is a note to be said around this that also in people in the immediate arm that was started on treatment, there was still the development of opportunistic diseases, although the risk of those opportunistic diseases were reduced compared to leaving people off treatment. So this really means that HIV is inducing immune deficiency very early in the course of the infection, and certainly the data indicates that antiviral treatment should be recommended for all HIV positive people. And of course, the challenge now will be how we can get the 25 million people not on treatment yet on treatment so they can enjoy that benefit as well. Thank you, Julio.